And the CDC is urging pregnant women and those who are planning to become pregnant to get vaccinated for COVID-19. The agency says new data shows pregnancy almost doubles the risk of death from the virus. Joining us now is Dr. David Bannock from UConn Health. And Dr. Bannock, thanks for joining us. How alarming is this new data?
So thank you for having me on. I think that this CDC communication is really important. It's concerning. It's something that, we've seen here at our hospital and hospitals throughout the state. Pregnant women coming into the hospital with COVID infection that can be quite severe.
What negative outcomes are we seeing with those pregnant women and even their babies?
So, I think what's become clear is that the risk to pregnant women is both to the pregnant woman herself. We're seeing increased rates of hospitalizations, intensive care, and also we're seeing adverse outcomes for the babies as well. So babies being born preterm, often requiring admission to the neonatal ICU as well. So, I think, this is really impacting both mom and baby quite significantly.
Are you seeing certain communities where there is more vaccine hesitancy, maybe not as many women are getting vaccinated?
So, I think with regard to the pregnant women, this is something that's being seen across the board, and something that I think we're really working hard towards improving. There are certain communities, here in Connecticut and across the country where vaccination rates may be a bit lower. And I think that outreach in those communities and increased education and on the importance of vaccination is really key. But this is something that we have to work at across the board and really encouraging pregnant women to get vaccinated because of how important it is to them and their babies.
And another question would just be, when should women get vaccinated in their pregnancy? Is there a certain time? Can they go in any trimester?
So there's no specific recommendation as far as the timing of the vaccination. I think it's really important that women, have that discussion with their gynecologist as far as timing. But really, what we're seeing is that it is important, and getting vaccinated during pregnancy really has a big impact on improving the health of the mom and baby.
All right, Dr. Bannock, thank you so much for your time. We appreciate it.
Thanks for having me on.